Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 19.
Studies show that if a woman feels supported through her birth, she's less likely to need other intervention to help relieve her discomfort. Support is like the number one thing that reduces the rate of C-sections and use of epidurals and other pain control. So just being present, and doula actually means with woman. And so that is what we do. We're with women. And I think, traditionally women were with women giving birth. We had our village around us to support us, and we've lost sight of that.
I am so thrilled to introduce our next guest, April Haugen, who earned her Master of Science of Midwifery and Bachelor of Science in Herbal Science from the Bastyr University in 2014. Between 2010 and 2014, she attended over 160 births as a student midwife. And from 2000 until present, she has been working as a doula. Her master thesis was titled Using Herbal Medicine for Labor Induction and Augmentation, an Evidence-Based Practice Guideline for Licensed Midwives. So April's nodding her head, looking at me. But you must have attended thousands of births between 2000 and now.
Not thousands, I would say hundreds for sure.
You've gotta be up there though.
Yeah, it's definitely up there.
Well, April was my doula. So for those who don't know who doula is, hang on tight. April's about to fill you in. But she is a very experienced midwife, and so I'm really excited to have her on the show. Now, if you're a guy listening, there's still some really interesting information for you to learn. So just because this is about midwifery doesn't mean that men can't learn too.
Absolutely.
And so that brings me to my first question. Well, welcome to the show.
Thank you. Glad to be here.
And for those that don't know what a doula is, please give our listeners insight as to what a doula is and why would having a doula be important for the whole family.
Right. I think that's a great question. Sometimes there's some misconception about what a doula is versus what a midwife is. A doula is a non-medicalized labor support professional who's gone through education to know normal birth, transition, stages of labor, and how women best cope in labor, and coping mechanisms and comfort measures. And they support the whole unit. A midwife is specifically to keep mom and baby safe, is, a licensed professional that's doing medical stuff with you pretty much. So that's kind of the difference, but it's a key role.
So a doula is there for the support system for the mom and for the partner, for the husband, and for the family, whereas the midwife is there to make sure that the baby and mom are safe.
Correct.
Throughout, but even before labor.
Right.
So doulas, you would want to when would you want to hire a doula?
I think you can hire a doula at any point in your pregnancy. Usually people start to look for one around 20 to 28 weeks, kind of in that second trimester, heading into the third trimester. But there's never a point in your pregnancy you can't say, hey, I need a doula. I'm going to start interviewing and looking. Because even early pregnancy, things can happen, unfortunately, that it would be nice to have extra support through that. And if you have a doula already in place, then they can be there to support you through that process.
Great. And when would you want to hire a midwife or start interviewing midwives?
Before you're pregnant.
That is actually a really good answer.
I think it's important to know who you're going to go see. So if you do have questions in the beginning part of pregnancy or, concerns, you have somebody you can reach out and contact immediately. A lot of times professionals don't have women start prenatal care until they're almost, if not in the second trimester, which is kind of the standard, but a lot happens in that first trimester before 14 weeks.
So for those who have no idea what a midwife is, just paint the picture. What does it look like to see a midwife?
To see a midwife, it's a primary healthcare provider specifically for pregnancy, birth, and postpartum care.
So you can order tests?
You order labs. They see you on the same schedule you would see an obstetrician. You would be seen monthly up until 28 weeks. After that, you're seen twice a month. until 36 weeks. And then after that, you're seen weekly, if not more frequently, as you get over your due date.
And so they check the health of the baby throughout the whole pregnancy. And
we listen to baby. We, measure your tummy. We talk to your baby. We educate you on health and wellness, things to expect in parenthood, things to expect in labor, kind of the whole process, what you're going through. It's normal, ways to comfort some of those uncomfortable things that can happen when you're pregnant, morning sickness, positional things, aches and pains, digestive upsets. We can send you for ultrasounds. Sometimes the provider will do it in their office depending if they have an ultrasound machine, but that's not typical. But they do order labs and ultrasounds and can refer to other providers as necessary along the pregnancy. And then they're there for you at your birth. Either you go to them for where they deliver or they come to you into your home. And then they see you on a specific basis on their own practice time, what they want to see you postpartumly, but up through 6 to 8 weeks completely.
Now, we've interviewed a lot of naturopaths on the show so far, and they have shared one of the biggest differences between seeing a naturopath as a patient and seeing an MD is that when you see a naturopath, you can see them sometimes. It's common for appointments to be 60 minutes long or 90 minutes long or at least 30 minutes long.
Absolutely.
Whereas with an MD, you're seeing the nurse longer than you're seeing the MD, and the MD is like a 15-minute thing. And so where my experience with midwives was that I saw them, what I felt, more often and with more time. I had more time with them than I did with the OB.
Absolutely. That's one of the biggest benefits, I think, to midwifery care. It's definitely more personalized care, and you get to know your provider. A lot of appointments are at least 30 minutes long, if not longer, up to the extent of 2 to 3 hours, depending on that provider's preference and just how the visit is going and the needs of the patient that they're seeing.
Have there been times in which you, as a midwife or midwives that you know, have caught something that an OB wouldn't have caught because you spend so much more time observing the patient?
I think so. There's a lot of discussion and just talking about life in general, how things are going in a person's life. Where in quick appointments, it's like, oh, baby's great, you're great, blood pressure's fine, let's go, versus what's going on in your life. I want to get to know you some and find out, how are you dealing with stress? How's your family life? Do you have anything going on in your life that you're concerned about? How are you coping with this pregnancy? And I think that plays a big role in the health of the pregnancy, as well as preventing premature birth and just the stress that mom's under in the environment that she's in. So,
is there a statistic that where women who see a midwife have more successful births than women who go into hospitals?
I don't know the number offhand, but MAWS, the Midwives Association in Washington State, is a great resource with a lot of links to some of the studies that have been done most recently with out-of-hospital birth outcomes, and just they're pretty phenomenal.
Yes, because if you go into a hospital, you immediately increase, in America,
right? You
immediately increase your chance of C-section.
Yes.
Not because you're sick and you need a C-section,
right?
But because you entered that hospital, and you should, by the way, if you decide to go with the hospital, check to see what that hospital's
C-section rate is.
C-section rate is, exactly, because there are hospitals that it's sort of like their default.
Yeah.
Now, why home birth versus hospital birth? If the mom's completely healthy and there's nothing to contraindicate, a home birth, why home birth versus hospital birth?
Well, first of all, it's a preference. Some people are going to be more comfortable in a hospital setting, but other people have a huge avoidance to a hospital setting just based on previous experiences there, risk of infection, exposure, those types of things. But once you're in the hospital, you definitely have a greater opportunity to have more intervention. And it's kind of like dangling a carrot in front of you when you are really, really, really hungry. So if you're trying to avoid certain interventions, having them not around is one of the benefits.
Like epidural.
Like an epidural. Education of knowing what you want and how you want that, I think, plays a big role in where you're choosing to give birth as well. But also, it's about the environment and a more personalized experience that's very unique and special to that couple that's giving birth to the baby. Mm-hmm. Babies are created in privacy; they should be born in privacy. It's not something that should be televised per se, and everybody in the world should know what's happening in your room and coming and going. So it's definitely If you think of mammals give birth in the dark, quiet, small spaces. They pull away from, watching eyes, and we're mammals, and that's how we instinctively will give birth better.
Right.
So
I love that. That's beautiful. Now, how does a doula play the role in helping the parents set the stage and prepare for pregnancy, or prepare for birth? How does what's the doula's role? Because there's a line between a doula and a midwife.
I think there's a lot of emotional part that comes through this pregnancy process and education, and a doula is a great person to have in that group of people that are supporting you through the process. They do a lot of the questioning of, because the mainstream population is choosing to use hospital-based providers, which appointments are super fast and there's not a lot of discussion happening, and they might have questions that don't necessarily feel they have time to ask or talk about. So doula can be that person that they are questioning different things and just normal parts of pregnancy. It's a good resource to have kind of in their pocket. The doula is available pretty much once they get hired to be there. As far as like on call, they're on call usually once the mom goes into dates after 37 weeks. So they try to schedule their lives around, their clients that are getting ready to be due. But as far as like how it helps the pregnancy, I don't know, that doula, they don't generally provide medical information, recommendations for different things. They'll refer to the provider for that, but they can definitely be that person in between that they're not quite sure. Is this normal? Is this not normal? Is this something I should be concerned about? But also education about, you actually have choices. You're a consumer. You can make decisions based on what you want your outcome to be for the most part, and it's important that you are aware of what your options are.
And many people don't even know that there are options.
Right.
Like my husband, I didn't know what a doula was. We had no idea the scope of practice of a midwife before we became pregnant.
Right.
And so that thus began our journey of researching and Googling and
Absolutely.
watching birthing documentaries and finding out that, a doula was your emotional support system and also could help answer your questions. Because, I'm freaking out thinking everything's abnormal.
Yeah.
And being able to call someone up who's experienced hundreds of births and no, that's normal, that's fine. Whereas with a midwife, you might not be able to call your midwife all the time and ask them, is this normal?
Most of the time your provider is not available 24/7 at your beck and call to ask questions to, unless it's truly an emergency or a problem with the pregnancy. There's a little bit more distance with availability per se. Doulas can be a great support, and studies show that if a woman feels supported through her birth, she's less likely to need other intervention to help relieve her discomfort. Support is like the number one thing that reduces the rate of C-sections and use of epidurals and other pain control.
Wow.
So just being present, and, doula actually means with woman. And so that is what we do. We're with women. And I think, traditionally women were with women giving birth. We had our village around us to support us, and we've lost sight of that.
Yes, we have.
And so I think this is not a new concept. It's just what we've named it and what we are using it as, and it's great.
When I took our prenatal classes with Penny Simpkin, who is like the godmother of doulas, by the way, go look up Penny Simpkin. Go watch her videos on YouTube. There's only a handful, but they're very informative. One of them is about when to cut the cord, which is
important.
Super important. Absolutely. And she has a great book, but I highly recommend. Penny Simpkin's fantastic, and she has really uplifted the doulas internationally. And when we took our training with her, it completely opened our eyes to so many things that we didn't know. We didn't know what was going to happen, right? We were like really kind of in that dark, right? And doulas can help shed light into things you didn't even know.
So true. You had no idea you needed to worry about that until you're like, what?
Exactly. And
that happens?
Yeah, exactly. And so, I think that with mainstream media, and one of the things she touched on was that 100 years ago when big pharma was really coming in, with big
Yeah.
medicine was coming in. And this is documented that they ran propaganda campaigns against natural medicine providers because they wanted to lure people into the hospitals. I mean, hospitals are a business, right?
Right.
And so they wanted people to, or women to come to hospitals for birthing because then you has this great stigma. Oh, that's where you go to give birth. It's such a beautiful place, the hospital. You feel
And
so
clean.
safe there, so clean there. And they ran these ad campaigns 100 years ago with like pictures of witches. And it said, you don't want this third world, backwater woman delivering your baby at home, and you don't know what diseases she's brought over from the third world or whatever.
Yes.
And really just bashing midwives for many years.
Mm-hmm.
And so now in society, even watching TV, they sort of make fun of midwives.
Right.
And they don't uplift midwives or educate. And so really, if you've heard of a midwife, you might not have even realized how much education they have to go through.
Right. We're not just little like old folks, in the back corner somewhere dragging our little bags around at night.
Yeah, right. Just
popping in to catch a baby.
Right, yeah. Just bring me some hot towels. I'm catching a baby. Right. Well,
Yeah.
So tell me what kind of education, what was it like becoming a midwife? Like we've seen TV shows about doctors getting trained in their residency, but there's not many shows about midwives or doulas going through their education.
Right.
So just give us a glimpse into what it was like going through your training to become a doula and then going through your training to become a midwife.
I think that's great. The doulas generally will go into, it's like a 2 or 3 day training for doulas. It talks about just normal birth, help, comfort measures, the scope of the role of a doula, making sure you don't step out of your scope. Simkin Center, which is actually through Bastyr University, is part of Penny Simkin that was created because of the birth professionals trainings that are done through that center. And one of them is becoming a doula. Other organizations like PALS and DONA do a lot of trainings for doula, so people can become certified as a doula and therefore have a overseeing organization that somebody has the ability to get feedback to if there's something that's happened with their doula that they don't like, or even just maintaining that boundary of what the role of a doula is. So it's kind of a way to stabilize that profession. It's not required to be certified to be a doula, though. That there's a lot of wonderful doulas that are not choosing to go that route, but have been, experienced and a lot of experience and have gotten just the knowledge by the experiences that they've been through. Sometimes doulas will choose to shadow another really experienced doula. There are hospitals too that have doula programs. I know some based in Seattle have actually hired on doulas as contractor providers to come in and support their families.
Wow.
And so that's, it's catching on because they're realizing no, doulas make an important difference in reducing our C-section rates. And what can we do to, it's cost preventative for sure to try to help within a hospital setting. But that's kind of the scope of a doula. It's not so much as it's not like a degree, a college degree, but there's a lot of extra education and knowledge that goes in. They have to pay out of pocket for this stuff, and it's not super cheap. A lot of times you're required to do some type of childbirth education classes to, get a knowledge about that, breastfeeding.
A lot of doulas I've met are lactation consultants as well. They
are. Yeah. A lot of people find other passions within the birth professional role that they really want to help. So some of them are childbirth educators, massage therapists, because massage is huge, touch. It's all kind of in that same realm of caring for other people. So there are a lot of professionals that do choose to then become a doula because they want to support women and families. As far as a midwife goes, in the United States, there's multiple routes to become a midwife. In other countries, there's pretty much a midwife that does everything, and there's not a lot of separation. But in our country, we seem to not figure out what works yet. So we keep trying to add on different professionals to a midwife. Nurse midwives are generally, they've gotten their bachelor's in nursing, they're an RN, and then they choose that they want to become a midwife, and so they get their master's degree in midwifery. And they generally can see a woman over the course of their lifetime. So they have prescriptive authority and are maintained primarily in hospital births. Like primarily they're hospital based. There are a couple of providers in Washington that chose to get home birth out of hospital experience outside of their education because it's not something they're ever taught. They don't need as many births to become licensed in the state of Washington. I think it's somewhere between 20 or 30.
That's low.
It's very low. But they also, in a hospital, have a lot of other providers to support them, right? There's an OB they can call, the NICU team, lots of nurses. And so it's more about getting that professional license and being able to practice to meet the needs of families. But they can see women for ongoing care through the course of their lifetime. So that's one type of midwife. The other type of midwife, another type of midwife, is a licensed midwife. They are periodically licensed in different states. In Washington State, you have to have 100 births, and there's a couple, so this is where it gets kind of confusing. Maybe I'll start at the bottom. So there's a lay midwife who has no professional education. She might have chosen to shadow somebody, get experience, hands-on, is not certified by anybody, is not licensed by anybody.
Which is how we did it
exactly.
For millions of years.
So that's kind of, and that's not illegal per se, but you can't charge for your services.
Oh, wow.
And you can't use medication because that's practicing medicine without a license.
Sure.
So those are still in the area. We do have them in multiple places statewide. And just as a kind of a precursor, midwifery is not legal in every state.
Right, because people are listening to this from around the world.
Exactly.
So you have to check what's legal in your state.
Yes. And sometimes it's illegal, which means there's no governing body to really monitor the profession, but it's not illegal. But there's nobody that's actually like, hey, yeah, we'll certify you or we'll license you. That's just not available. So licensed midwives or certified professional midwives aren't always legal in every state. Wow. And the license doesn't transfer from state to state. You have to apply for that just based on those rules in that state. A nurse midwife is legal in every state. It's a national certification. Certified professional midwives it's a national certification, but it has a very limited scope as far as each individual state. So in some states, a certified professional midwife is somebody that does everything per se a licensed midwife does in Washington State. They've gone through 3 years of training or more education. It can be either through a school that does certificates, and then they get their CPM because they have to apply through that organization, the NACPM, to get the CPM stamp behind their name, and they have to pass those exams. The other schools are, I'm going to focus on Washington specifically because that's what I know the best. But if a CPM got trained, per se, in Utah and wanted to become a licensed midwife in Washington, but they didn't have a bachelor's degree or a master's degree and they weren't a nurse, how would they go about doing that? They have to sit for the state exam, and they also have to show that they have done this education. So they have to provide this portfolio of information, and also it's called direct entry midwifery, where they basically are working with another midwife, so many births, and they get signed off as saying, yes, I trust this person, and then they're allowed to sit for their exams, and then the state of Washington will grant them a license. Or you can also be in one of the schools that then gives you a degree. It's not a certificate. In Washington State, it's Bastyr University, which is a 3 years master's degree. And, I think all of the midwifery educational schools are pretty intensive. I can only speak for the one that I went through, but I do know that midwifery school is not easy. Your life is completely flipped upside down as you're tracing after all these other midwives, and women, and you're now controlled over due dates and prenatal appointments, and everything else in your life kind of comes last while you're in school. So, through Bastyr University, the midwives, go through school for 3 years. They have to then show that they've completed so many things during birth, and there's a massive checklist that has to be checked off. They have to have multiple preceptors. So, the end of your first year is when you get set up with your midwife that you're going to be shadowing and working with and learning some of those hands-on skills. And then you're with them for 2.5 years?
And during that time, you're going to be attending over 100 births.
Correct. So each school has their own requirement for graduation, but the state of Washington requires 100 for us to become licensed. Most of us get over that, but if you're not looking for that, then you might choose to do something else with the remaining 40 for say if you only need 60.
Right. There was a documentary. Oh gosh, you probably know it.
I'm horrible with names. I probably don't.
Okay. Go to Netflix, type in birth. But no, there's maybe it was one of those really cool birthing documentaries, and
like Business of Being Born.
Maybe it was a Business of Being Born. It
Maybe.
might have been that one, but really freaked me out that MDs, when they become like, OBs, right? Like the MDs that deliver babies.
Right.
Don't have any experience like with natural home birth. Like they don't.
It is Business of Being Born.
Right. And they're just like, they need for the woman to be hooked up to a monitor to know what's going on. And it's so ridiculous when you look at in the hospital setting, it's like the nurses are staring. They're not looking at the mom.
They're staring at the machine.
They're staring at the machine. And I was in labor for 44 hours and I know, like I'd be like, hey, I'm over here. Like, hello.
Exactly.
And the doctors didn't, very seldom came into the room because the nurses would just bring them the my chart. Be like, here's the baby, his heart rate. Yeah. The mom's fine. Okay, great. And whereas with midwives, I mean, they can look at you and go, okay, I know she's in active labor. Okay, I know, she's at this phase. And the midwives don't jump in and check how many centimeters you're dilated every hour, whereas the doctors in the hospital want to check on you. And that increases anxiety, which can slow down labor.
Absolutely.
And midwives don't have to because they have this ability. They've been trained so much in observing the mom, and they know what stages of where you are and that you're healthy during the labor, and that they know what to look for to make sure that,
they know normal really, really well.
Yeah.
That's one of the benefits. A midwife, is not seeing these high-risk, complicated pregnancies. And so for her, everybody's normal until you're not. And we pick up on that not normal really fast.
Yeah. Whereas a hospital is like looking for,
what else is going wrong? What else can we find out? With us, we're just assuming you're fine until things aren't. And then we figure out what plan needs to be made next. But we deal with low risk women through pregnancy too, so we're assuming their birth is going to be low risk.
Right, but you've screened for everything and you've looked for everything, and so there's a really big difference in your experience, depending on what you choose. Is there ever a time when a woman could choose to be in the hospital but still have a midwife?
Absolutely. There are some practices in the area that actually, there is hospital-based midwives, right? So there's a nurse midwife, and so sometimes that's a good fit for that person. Just know that they're always in group practices, so you might not get the midwife you bonded with the most when you actually go into labor, because they all have call schedules, and it's important to meet everybody so you're not surprised with who shows up. But there are some practices where you can hire an out-of-hospital midwife for your prenatal care, and then just let her know from the beginning, when I go into dates, I want to have a hospital birth. And that can be set up ahead of time where there's a receiving provider between 36 and 37 weeks that then takes on your care.
That might be the best of both worlds for some people, because then they get way more attention from the midwife in their prenatal care.
Well, and then sometimes the midwife stays on as that woman's doula.
Yes.
And then picks up care postpartum.
Yes.
And so that can be really helpful.
Yes, absolutely.
And sometimes that, between labor starting and that 37-week mark can be co-managed, where the midwife is still seeing the patient, but then she's seeing every other appointment with the OB provider, and they're working together to make sure this mom is feeling like her needs are being met.
Right. You can never have enough providers.
Right.
And it's like, because, I mean, you yourself listening, you might want to have the crunchy granola hippie birth that, I wanted. But your family might not support you in it. Right. Or, maybe you have your mother-in-law's freaking out, or maybe you have a minor complication that just doesn't allow legally for a midwife to do a home birth, like gestational diabetes. And so, or preeclampsia, right?
Right.
And so at that point, it's always about that we have to keep the goal in mind, because I think I got lost in the really wanting the holistic birth experience. And then every time there was a hiccup in the road, I got really upset about it. I had to emotionally process it, and just getting that it's about the healthiest outcome, healthiest baby, healthiest mom. And sometimes that means making choices like, okay, now we're going to do a hospital birth, or okay,
Right.
now we're not, we're going to do this instead of this. But you can still have your midwife, if you've asked her if she can be your doula,
Mm-hmm.
because she can still be there to answer your questions and be an advocate. I think it's
Absolutely.
really, really important. I'm sorry, I'm like taking over right now,
No,
but
it's so
it's
true.
really important to have an advocate for the dad too, and for the mom, for the whole family, because when you're in labor, you're not thinking. You think you'll think, but you're not thinking. And the dad is like, if he's present,
Overwhelmed.
or if the partner's present, they're dealing with their own stuff and helping the mom, but they might not also be able to be present to answer questions and make decisions on the fly. Like if the OB comes in and goes, okay, well, I don't like this, so now we're gonna do this.
Right.
And a lot of times hospitals will go, okay, she's been in labor 10 hours. We need to start prepping her for C-section, which is ridiculous. There's
Right.
the baby's still healthy, the mom's still healthy, but this is, and this is again the business of being born. I think this documentary touched on that there are hospitals in New York, because that's where they were,
Yeah.
where they have a rule that if the mom's in labor for like 8 hours, that's it, C-section.
That's horrible.
It is absolutely horrible.
Well, and doulas make a role, too, of just being present and allowing the families to have time to ask questions. So they don't usually interact completely straight on with the providers. That's not their job. Their job is to support you and what questions to ask and helping you dig for more answers. As long as things are not emergent, there's no reason you shouldn't be given more time and get the response. So you feel confident and comfortable with the choice that you're choosing.
Yeah.
Knowing everything.
Yeah.
Which is so important because nobody knows how birth is going to go.
Right.
It's a complete gamble every single time. You can only do the best of what you're given,
Yeah.
right? So trying to decide what that looks like and what that means and what your alternatives are super important.
Yeah. And it's so good to learn this now, because I'm sure most of our listeners aren't pregnant.
Yeah.
But it's so good to know this now, because if you do end up having, a child down the road, knowing that you have the options, or if a family member or a friend,
Right.
letting them know, hey, you should look into a midwife, you should look into a doula, either as the primary or as an additional support.
For sure. It's interesting. A lot of people that potentially might sign up for midwifery care, but they're still not sure of how they want to give birth. If they're dead set on no drugs, right? Like that's a huge thing in our society. A lot of times they end up changing their mind and realizing that it's not so much as what the mom goes through as what the baby's exposed to, and wanting the best for their child. And so they feel strong and they feel empowered to be able to go through those choices. And ultimately, if there needs to be another decision made, then that's done, right?
Yes.
Based on what her needs are. But she definitely starts to feel empowered about her choices when she understands what those are.
And the doula and the midwife can help her understand.
Yeah.
Right.
And the other parent is such a key player in feeling like they're supported,
Mm-hmm.
A doula specifically can help relieve some of the stress on the other parent. The biggest concern I find from families when it comes to hiring a doula is the other partner is concerned that doula is going to take over their role, interfere with their time in labor, what their job is, and well, what am I going to do if they're here, if they're meeting your needs? But a good doula, can sit in the corner and talk to you, or can breathe with you with every contraction. And sometimes you just need to be present to provide that support. It doesn't mean that you're taking the place of the partner.
Right.
And in other instances, that doula needs to be that partner because that partner's super uncomfortable with what's happening and doesn't know what to do. So they can kind of be there to help guide them. Well, why don't you try this? Or it's okay for you to go to the bathroom.
Yeah.
Maybe you should go lay down and take a nap. And then they're able to do that without feeling like they're deserting their woman in labor.
Right. Or they can take shifts. You know?
I think that they
Exactly.
play a key part with the unit. It's not so much as just supporting the mom as it is supporting them as a couple and their experience.
I think the whole point of this interview is to let you know that you're not alone.
For sure.
And that you can build an entire team around you to support you in your belief system. So if you're very holistic minded and you want to use herbs and you want to, perfect example. I mean, your thesis was on herbal medicine in midwifery. If you want to use natural medicine throughout your pregnancy, then midwives would be able to answer some questions about
sure.
about what herbs are safe and what supplements are safe and what supplements you absolutely should be taking.
Right.
Because you absolutely should be taking prenatal supplements even
Yes.
before
Before
getting
you're pregnant.
Yes, and we're April is actually in studio to film with us for our website, so we're gonna have some great footage of April teaching about
Yay.
prenatal care. And so if you're pregnant or you're gonna be pregnant or one of your friends gonna be pregnant, we're gonna have a whole training series from April because she is the bomb. I mean,
Thank you.
For me, I know that if I hadn't had you during my labor, I would have had a C-section because
agree.
things were going the way they were going. And 44 hours of labor,
Yes.
of induced labor.
It's intense.
And
so
April
hard.
turned to me and said, if we don't change something right now, they're going to do. I mean, and
They're
the
going
baby,
to call it. They
the
will.
baby was safe. The
Yep.
baby was healthy the whole delivery, but it was just. I was stalled out, not moving. It
Right.
was labor, and I know that you were the only person, and we had a ton of support people, and you're the only person that said, okay, we need to change some things up. We need to try something different.
We have to have that hard conversation about maybe we should consider other things.
But I watched the hospital staff as they all just stood in the corner. They would just come in the room, stare in the corner, look at the machine, and leave.
Right.
And none of them were saying, "Okay, let's try this. Or we need to think about different options to prevent C-section."
Right.
And you were seeing this happen, and it was just like.
It was glaringly obvious, but nobody wanted to voice it.
And it wasn't obvious to me because I was in
the
so
middle
much
of
pain.
it.
I couldn't see what was going on. But to have that extra person who's really experienced to be on your side, who isn't one of the hospital staff.
Right.
They're not on the hospital's payroll.
Right.
And they're an experienced.
And ultimately, it's about your experience of your birth.
Yeah.
How do you want to look back and look at this experience? Do you want to think that you've tried everything?
Yeah.
Right? Instead of time running out when you didn't even know the time was running out.
Right.
And all of a sudden they're now, we have to do a C-section. There's no other choice. Right. Well, what?
Right. And I mean, in certain circumstances, C-section is a good thing because
it's great if it's needed.
But a lot of times, I mean, if you look at the statistics in America, it is not needed as much as we're doing it.
We're almost 40% nationwide C-section rate.
That is horrible.
And with midwives, and it might vary from practice to practice, but generally it's definitely under 5%.
Are you kidding me?
No, it's huge. So right now we have some really big studies that we're collecting information on that, licensed midwives are contributing all their birth data to after patients approve. It's non-identifiable birth information, but we are tracking our statistics and our outcomes because we have such amazing statistical outcomes that we want to help show that to the world and say, hey, look, you're doing something wrong. Maybe we're doing something right. And maybe insurance companies specifically need to pay attention to lowering the cost of how much it costs to have a baby in the United States. And we are not, for infant and maternal mortality, like how many moms and babies die every year. We should be at the very bottom of the list. Mm-hmm. The very, very bottom. And we're not. We're higher than even third world countries.
Really?
Which is super sad. I think I don't have the number on the top of my head, right. But it's pretty horrific.
I remember that graph. If you just Google it, infant mortality
in the United States and where we fall compared to other countries, we should be, considering we are industrialized and we have all of this knowledge and medical knowledge.
Well, we're the country that spends the most on
healthcare costs.
On healthcare, in quotes, healthcare.
Yes.
Which is, pharmaceutical,
right.
Drug-based healthcare. But we spend the most money on it, and you'd think that would mean we'd have really good birth outcomes.
No, we don't.
But there is a correlation between our high C-section rates and our high infant mortality rates.
Yep.
And that's why I'm an advocate for people knowing more about midwifery, because with midwifery, there's less than 5% C-section rate, whereas if you nationwide, it's go in a hospital, you have a 40% chance of being...
Yeah. And each hospital varies a little bit, and I think in certain states it's less or more. And I know It's just really sad. You can't be in a room with 10 women and think 4 of them need a C-section. I mean, really?
Right.
I mean, that's just okay.
Yeah,
that
how
doesn't
did we
make any
survive?
sense.
How did we survive the
We would
thousands
not
of
be
years?
here if we all needed C-sections, like almost half of us.
Right. Well, and they think it's like they're marketing it as this convenience. Oh, you can
Right.
book when you have your baby. Just come on in. We'll gas you up. We'll, we'll drug you up. We'll pull the baby out, and then we'll stitch you all up, and you can go home.
Well, and part of it too is 90% of women are, getting epidurals, being induced. All of that will increase your risk of a C-section. And so by choosing to have the intervention when you don't need it to begin with, you're jumping down the road where it's going to more likely happen anyways.
Yes. Yeah.
So with midwifery care, and I tell my patients this, if we end up needing a C-section, you're going to know it's because it was absolutely necessary. And we're so thankful. So thankful to have that option.
Yeah, midwives won't try to prevent you from an intervention if you need it.
Right. We encourage the use of it because we're glad we have it if it's absolutely needed.
Yeah.
And so that's one of the really big benefits. So you can look back and think, I'm glad, right?
Yeah.
But it's not if my baby was born at home, we would have died situation.
Right.
Which is what we hear all the time. We don't create the problem generally that's causing the massive emergent thing that's happening. So that's something to think about too.
Yeah, where is this information coming from and who's benefiting from it?
Exactly.
Right. I have just a list of questions for you about nutrition and herbs and diet.
Exciting.
But you know what? We need to wrap up this interview.
Running out of time.
Or else it'll be like a 2-hour-long podcast,
Right.
which, I could totally have you here for that long. But I'm going to have you back on the show. So
wonderful.
We've got, I've got so many really juicy, great questions for you for the next episode. But please share with our listeners how they can contact you. So if they're in Ellensburg, or the surrounding area in Central Washington, or if they have any friends in Central Washington, send them to April. But even if you're not, and you want to ask April a question, or maybe do some long distance education with her, because she also teaches. She's very active in the birthing community and prenatal care community.
Absolutely.
Constantly giving lectures and teaching, and having groups over at her house.
It's about support, making that family unit so women have other women to depend on.
Absolutely. So what's the website that they can find you?
Well, MAWS, so the Midwives Association of Washington State, is where you can find any midwife in this area, specifically birth center, midwife. Our website is thesunrisemidwifery.net.
The Sunrise Midwifery.
Or just Sunrise. So it's www.sunrisemidwifery.net.
Well, there would be a
dot after
I will edit that. Yes.
So that's our practice, and we cover through the Yakima Valley and up over to Moses Lake. There are a few midwives, in that area, but they're definitely a lot harder to find than on the 405 corridor by Seattle and up north. So
yeah, most of our listeners are going to be around the world. So
look in your area. Even if it says midwifery is illegal or illegal, there will be a midwife practicing. I can guarantee you.
Yes.
And so sometimes you really have to hunt it down. But sometimes, unfortunately, there's one midwife that's covering hundreds of miles to meet the needs of patients, clients that deserve to have the option. And so it's worth looking. It's worth looking into if that's what you want. For sure.
And to wrap it up, I remember the name of the documentary.
Oh, great.
It is Orgasmic Birth.
Yes.
Which my husband and I watched when we first discovered we were pregnant, like within our first month. It's not what you think. It's not about having orgasms while you're giving birth.
Right.
Although some women do, which, that's why I watched it, because I was like, really?
How does this happen? Let's make this happen.
Yeah, I don't want the pain. I'm thinking in my mind, I'm just going to be like screaming for 12 hours. And
how to enjoy the process.
I want to enjoy it, right?
Yeah.
And so it was the most liberating documentary, and Penny Simkin is in that documentary. It's really beautiful. I highly recommend it. Just go Google Orgasmic Birth, and you can rent it, download it, stream it from their website. But it is it's fantastic, and that's what opened the floodgates for us to
Everything
get
else.
into,
Yes.
to get into meeting you and doulas and midwives. So highly recommend it.
That's wonderful.
Excellent. Well, April, it was just fantastic having you here, and we're going to have you back because you have so much knowledge.
We have more to talk about,
we
for
have
sure.
more to talk about.
Yes.
So thank you so much,
You're
April.
so welcome, and thank you.
How would you like to learn from top naturopathic physicians? Go to freedoctorcourse.com and sign up for the free course that'll email you videos with tips and tricks to achieving optimal health. That's freedoctorcourse.com. freedoctorcourse.com.